Well, it's been a very interesting start to 2024. In January, we've seen a major intervention coming from outside of Ireland, from somebody with 145 million followers on Twitter, which of course is Elon Musk, the owner of Twitter, very concerned about the Irish hate speech bill. He's not the only one. Conor McGregor's put his oar in the water with his 10.5 million followers, as well as Michael Schellenberger, the author and environmentalist and campaigner, also concerned about what's happening around the hate speech bill. You might say, well, what is the concern about the hate speech bill? Well, it's the first time, certainly that I'm aware, where in Ireland we will be introducing legislation which is now in its eighth stage in the Senate. I mean, it's very, very close to being signed off by the president if he doesn't refer it to the Supreme Court, which I believe he should, whereby you could be prosecuted for a thought, not for an action, but for a thought. So there you are, you're in the pub, you're in the restaurant, you're in the cafe, somebody overhears you overhears you saying something that they deem to be potentially harmful or hateful towards named minorities, and they're of course linked to the bill itself. And there's a complaint made to the Gardaí. The Gardaí get a bench warrant, come to your house, and they can confiscate your mobile phone, your laptop, all your computers, and those of every other member of the family, including your children, and then examine their drives looking for content that could be deemed to be hateful towards these named minorities, and thereby you become prosecuted. Obviously, people will say, as politicians are, well, that's not the intention of the bill. May very well be the case. That's not the intention of the bill, although I would argue that the intention of the bill is, in fact, to send a deep chill through freedom of speech, through public discourse. That's its intent, and it's and that's what will be its outcome. They will argue that that an independent judiciary, of course, would look at these individual prosecutions, and they might look at it very quizzically, looking at the act itself. In fact, the act itself could be subject to judicial review. All of that, I accept all of that. But that's not the issue. The issue is that it will cause an individual citizen extreme harm for several years while they're going through the Irish prosecution system. And that's its intent. Whether or not anybody gets prosecuted or not, or in what numbers they get prosecuted, will not be its main threat. Its main threat is to stop public discourse. And that's why you need to begin to understand what's going on in the hate speech bill. There is an activist group in Ireland called Free Speech Ireland. You'll find them on X and other platforms with a petition out that you can sign in order to object to the implementation of this massive overreach to deal with what is a problem. There's no doubt about that's out there. It's a massive overreach. And of course, it's not just happening in Ireland, because all these things are interconnected, which is a big statement to say. But when we look just behind it, what do we see? We see the World Health Organization treaty coming in. This has been designed by the Geneva-based unelected organization that has overarched the whole approach to the coronavirus. And this particular treaty, which I've examined and I've had it examined, is quite clear that it is binding on member states, because they've already removed the non-binding terminology in the existing regulations, which will be replaced, of course, by the treaty. And what does the treaty say? Well, the treaty allows the Director General, Tedros, to decide unilaterally that there's a health emergency here, there, or anywhere on the planet, without recourse to member states. And also to insist on those that signed the treaty that they clamp down on disinformation and misinformation. There it is again. Funny where it turns up, because during January, the World Economic Forum had its conference in Davos in Switzerland, and it was visited by a former trustee of the World Economic Forum, who is now the president of the EU Commission, Ursula von der Leyen. And she's talking openly about the major priority for the EU as a clampdown on disinformation and misinformation. It's quite clear that the tip of the spear, therefore, is the hate speech bill in Ireland, and it's only part of it. It's aimed directly at the heart of Twitter and other platforms that aren't playing along with the kind of globalist agenda. So therefore, it's deeply ironic to talk about clamping down on disinformation and misinformation when what they're really talking about from the WHO's perspective is anything that's counter-science. And there's a lot of counter-science out there. Of course, the WHO itself is first cousin to the United Nations, which has its IPCC models all around climate change. And a lot of the information that's out there, that's counter to the narrative, is not available. It's been clamped down as well on lots of platforms by using algorithms to kind of curate the echo chambers that have been set up by the algorithms, and then to remove content that might be regarded as counter-narrative. In other words, officially disinformation and misinformation. It's all very Orwellian-like. I mean, it's how we get to collective wisdom on any matter is by public engagement. It very quickly becomes clear who the nutcases are out there peddling all sorts of nonsense. That's simply because it doesn't stick, because people engage in critical thinking, they expose this kind of stuff themselves. It doesn't need to be regulated from the centre. So why is it being regulated from the centre? The very centre of which itself has very serious questions to answer, which I'll come to in a moment. So let me just put that in the form of questions. But before I do, just to remind those that are listening to this, that in 2005, I did 4 one-hour stand-up sessions in the Helix, which was broadcast through RT as Rip Off Republic, which I co-wrote and presented. And, you know, after that, I was demanded that I would come before a Dáil committee to deal with the misinformation and disinformation that this programme put out there, because it garnered the highest audiences for factual entertainment television and RT in its history. That's what happened at the time as the public reacted to the information that was being presented. The government quickly cancelled that hearing when it became clear that the facts as presented, 85% of them, had actually come from government agencies themselves. So when I put these questions across, they come after 3.5 years of looking at all of this. And these aren't conclusions or questions that I come to lightly. The first question is, why was the definition of a pandemic changed several years before this pandemic was declared, to remove or lower the barrier to what was a pandemic, to remove the large fatality numbers itself, and to reduce the impact of the disease, for closing factories and basically closing down large parts of the economy because people were simply too sick to turn up to work. Instead, it just focused on the infectability. Why was the PCR test brought out so quickly after the discovery of the novel coronavirus in China? I mean, we're only talking about a matter of days, and PCR tests were being shipped. Why was the PCR test set at 45 degrees of magnification when half that, or a little bit more than half that, and this is like Richter scale magnification, would have found the coronavirus? I mean, at that level of magnification, theoretically speaking, you could find traces of the bubonic plague in the world population, even the Justinian plague during Roman times, potentially. Little bits of molecules that could be magnified and therefore create a situation where you end up with a phantom pandemic, something that's not really there in the numbers that are being presented. Why was the definite vaccine changed? We were told that these vaccines, which are really emergency use drugs, not vaccines, that these would stop the spread of coronavirus. Just take your vaccine and keep taking your vaccine. But these were emergency use authorizations. They weren't vaccines at all, and they didn't do what they said on the tin. Wasn't that misinformation and disinformation? We were told that the spike protein wouldn't go beyond the injection site. Well, it has. I mean, it's quite clear it's gone to many other organs of the bodies. And this is new technology. We just don't understand its impact. But what we are seeing is a substantial level of reports now coming throughout the world from medics about harm from the vaccine itself. Why should we be surprised? It was rushed out. It was new. And it was an emergency use. It got an emergency use authorization because existing medicines that were being used by some doctors throughout the world to deal with the coronavirus, such as ivermectin and hydroxychloroquine, were attacked viciously in the media, a concerted attack, using the same terminology on the same days across competing media organizations, especially in the United States. I mean, these are facts. This is what happened. And then when we push on from that, we then have to ask ourselves about the actual level of deaths recorded. I mean, there is a conflict of evidence between the CSO, which is recorded, the actual number of deaths purely from coronavirus, versus the number of deaths that were being broadcast on deaths which included potential deaths caused by coronavirus, when in point of fact there was several underlying health conditions contributing. I mean, this does not mean to say that the virus itself wasn't dangerous. Of course, it was lethal for particularly elderly people or those with underlying health conditions. There was no doubt about that. But we ended up in a lockdown situation because of a massive panic that was created through the aforementioned PR tests, and then models that were put out there suggesting millions of deaths, which didn't happen. In point of fact, what we're now seeing potentially is far greater harm from the vaccine itself than from coronavirus. I mean, that seems to be a question that needs to be answered. And what about the Hippocratic Oath? We were told that, the Hippocratic Oath, which guided the medical profession, was first do no harm. Well, why were then we were openly injecting and accepting governments tell us inject kids with perfectly healthy immune systems? Mum and dad were being told to inject these things into their arms. despite the fact that it was quite clear that the risk from the vaccine itself was higher than the risk to these children because of very strong immune systems from the coronavirus. Why did we allow that to happen? There's 19,000 medical professionals regulated by the Irish Medical Council. Well, where were they? Where were their voices? And by the way, that's a question you could ask in many countries. There was only a small handful of people stood up. Such was the chill, such was the fear, such was the threat being put across the medical profession. You were to do this one-size-fits-all solution to this global thing and keep your mouth shut. Meanwhile, the technology companies themselves were coordinating with the regulators, the health regulators, to clamp down on any kind of information that was deemed to be counter-narrative. And I'm talking here about counter-science, not just opinions from people, but counter-science. And that's what happened. And as a consequence of that, there has been a severe chill and a diminution of critical thinking about this whole area. Well, it's now all beginning to break out, isn't it? We're beginning to see information coming through, and it's being discussed throughout the world openly. But it just hasn't penetrated the Republic of Ireland, where mainstream media got so on side with the propaganda that was coming through from the top that they cannot now face the fact that they were completely wrong. They were on the wrong side of the whole thing. I mean, that's my opinion. You can make your own opinion yourself, and I'd urge you to do so. There's lots of information that are out there. It's just you're not going to read it through the mainstream media in Ireland. You have to go beyond it to see what's going on. Now, let me just give you a couple of quick examples as to why that's the case. Well, the most recent example. There's been practically no coverage whatsoever on what's been going on in Europe. It started in Germany, started in Berlin, being closed down by truckers and by farmers. It spread to Italy, it spread to France, it's in Belgium, it's even in Scotland, and it may be coming in Ireland. That hasn't been covered. And what's going on there? Well, farmers are being told that they need to cull the herd to reduce the methane emissions, notwithstanding the fact that methane breaks down into carbon dioxide very quickly over a number of years, that they are to take the brunt of the impact of the UN climate change models. When you then try and Google counter-narrative or counter-science behind the hypothesis that all of this warming, which is really, since the end of the last little ice age from 1850 forward, the planet has been warming. But like my own opinion in looking into all of this and look into it yourself and come to your own conclusions, is that we should be putting the trillions that are required into engineering solutions and into dealing with the warming that's going on as a consequence of us entering a warming period after a cold period that started around 1300 and ended around 1850. And also, I believe that this fixation with modelling and the concept that the bit of carbon dioxide that's created by human activity is actually having the effect that's been stated is that interconnection is highly suspect. It's a hypothesis, and it remains a hypothesis, and we really should be looking after dealing with the warming rather than trying to think that we can actually stop it by driving ourselves into potential poverty. Because that's where we would go, especially if we would try to get to zero carbon, which I don't think is realistic over the period in question, notwithstanding all the fantastic entrepreneurship and innovation coming through. And all that will happen anyway, because we've lots of problems that need addressing. But this is not the way to do it. That's my own opinion, but you come to your own. But what I can tell you is that it is quite clear across the board that there's bits of a chessboard clicking together. When you look at the EU, what do we see but digital ID? So we're now going to have digital IDs in Europe. When you align that then with vaccine passports, you can quickly see that your digital ID will contain your vaccine passport. Lagarde of the ECB is accelerating central bank digital currency. Is it a good thing? Depends on how it's implemented, but not on the basis of that envisaged by the chief of the Bank for International Settlements, which is the central bank, who's made it quite clear that this will be programmable currency, and every €100 and $100, we'll know where it's spent by whom, to do what and where. Now, so this is surveillance at centralized level by mega computers on you and what you're doing. Are you allowed to take that flight? Are you at your personal carbon limit? Have you been spreading disinformation and misinformation? And should you be punished with automatic fines through your digital currency? I mean, this is what's been set up. It's quite clear it's been set up that way, because you can read about a lot of this on the World Economic Forum's website. You just have to join the dots and then start engaging in the online community in discussion about all of this. Discussion with academics, with reasonable people that have examined the evidence and are coming to the same conclusions themselves, but finding it almost impossible to break through to the silence around mainstream media, because that will change as well. And let me tell you why. The World Health Organization treaty, when it comes into the Republic of Ireland, is going to have a significant problem. We are the only nation in Europe, perhaps in the world, which are entitled under law to a referendum in the event of an external treaty which will impact our sovereignty, and this will. And there's no doubt about that. And this is the Crotty ruling from 1987. So we will be insisting on our rights under Crotty to a referendum. You might say, well, surely we would have that automatically. And the answer is no. I have an email dated late November 2023 from the General Secretary of the Department of Health, which makes it quite clear that the Cabinet think this is a great treaty. It's wonderful. And we're just going to ratify it at Cabinet. Well, are you indeed? You have forgotten about Crotty. And also the fact that if you remove from an Irish person something that they believe to be a right, you're really going to awaken a sleeping giant, because that's what's going to happen. So either give us our rights under Crotty by decision at government, or be forced to do so in a humiliating defeat in the High Court, because that's what will happen. One way or the other, we're going to discuss the WHO treaty during a public referendum, which is a far superior way of inquiring into what happened over the last 3 or 4 years than the so-called government self-inquiry into itself that's envisaged. That's not going to point fingers at anybody. We'll have our own inquiry, but we'll do it through the process of a national referendum on the World Health Organization treaty. So these things are happening. They're happening now. These things discussed a few years ago, it was all a conspiracy theory. And of course, when I ask people, well, what is the conspiracy theory that you're alleging? What is the theory? And where is the conspiracy? And of course, it's met by deafening silence. This isn't a conspiracy. These are facts. They're facts that are out there, and they're serious questions that have to be asked and answered. And they're not being asked and answered in the mainstream media, with the exception of some organizations like Riff Media, for example, and others that are actively discussing this online. But if the, let's call it the complex, the wannabe 21st century totalitarians get their way, we won't be discussing it online. We won't be discussing it at all. There'll be a clampdown on misinformation and disinformation, and you will be punished through your digital ID and your central bank digital currency inside in your wallet, because that's the intention, unless, of course, it's resisted and it's ring-fenced and protected. And the only way that can be done is by the people waking up to what's going on and barking at the local politicians to do something about it. Now, I believe there's sweeping political change coming in, that we're at a pivot point in January 2024, a pivot point as clearly seen by what's happening throughout Europe, as those involved in the food industry and agriculture wake up to the threat on their doorstep and saying, we've had enough of this. We've had enough of this nonsense, and a lot of it woke nonsense. We just had enough. And we're not putting up with it, because these wannabe totalitarians that will make a vast fortune out of controlling the world population and treating us like battery hens, that we'll own nothing, we'll rent everything, and we will be happy, which, by the way, the Klaus Schwab has said as the head of the World Economic Forum, that somehow we're just going to put up with it, and we're going to put up with all of the people that he has claimed have been planted throughout the civil organizations and political organizations throughout the world over the last number of decades by his organization, the World Economic Forum. And remember, former trustee of which is the president of the EU Commission, Ursula von der Leyen. So these things are all there, including all of those that have been campaigning for zero COVID. Remember the zero COVIDistas. Where are they now? As the data comes through, nowhere to be seen. And, the problem with the existing media organizations in Ireland is that they promulgated all of this. They took the soup, they promulgated it through us. They drove fear into the heart of society. It created draconian demonization of those that hadn't taken the vaccine. And I think the apex of all of that, the worst part of it really was in 2021. And I know because it happened on my phone. I have the evidence to prove this. When I broadcast through Twitter at the time, a letter from Beaumont Hospital telling those that are on the organ transplant list that if they weren't vaccinated, they were shoved off the list. It was deemed to be disinformation and misinformation and fakery, until finally, after several days of this, it was published in one of the newspapers, and then the next day Beaumont Hospital rescinded. But in the meantime, at the start of that campaign, I gave the information to the most senior person in RT dealing with this matter. He has since left. And I got back a message from that person to say that they weren't going to take this. They weren't going to broadcast this message now. In fact, the same person was too busy getting a couple of journalists out of Afghanistan. That's in evidence. I'm saying that as a matter of fact, on the record, that decision for RT not to run the story as a main story for the weekend, after all, I would have thought the fact that a civilized country was now telling people, awaiting organ transplants, that they can't have one unless they're jabbed, to be an absolutely, extreme example of where we had gone to after we decided to go into vaccine passports and all of that. They should have never been signed into law. But they weren't referred to the Supreme Court, sadly, by the President, Michael D. Higgins. It remains to be seen whether he will refer the hate speech bill to the Supreme Court. I believe he should. I believe it's the one good thing that he could do while he's in office. certainly the World Health Organization treaty will be out of his hands because it's going to be going into public referendum through Crotty, in my opinion. So there you go. Some people listening to this will know bits of this. Smaller numbers will know all of it. Most people would may be listening to this for the first time. If you are, don't believe me. Don't believe a word of what I've just said. Just think about the questions that I've raised and go and examine the questions yourself independently using your critical thinking faculty in order to come to your own conclusions, and then join in the debate. That's all you have to do. Join in the debate and understand that what's kind of going on here is terraforming Ireland in open sight while we watch and we stand by and say nothing to try and generate a type of country and Europe and a global situation whereby we are reduced to serfs. We are reduced to just worker bees, call us what you want, battery hens in a system of extreme control using technology. 21st century totalitarianism has arrived, and there's an attempt to click it into place. I don't believe that attempt will work, but it certainly won't work the more people wake up and become active and start talking openly about this. That's the challenge. Please follow us. Follow everybody talking about all these things online. Join us. Thank you.